Hi, my name is Dr. Catrina Jaime. I'm the head of the Public Health and Health Equity Program. As I was saying, the equitable future in public health starts with us coming together as a community. My community started in the Philippines with my Lola, my grandmother. This is a family photo of her 7 children in school uniforms, and she was married at 16 with a high school diploma. She wanted more for her children and to be able to go to university. This is my mother. She too believed that an education was the best way for my brothers and I to get a brighter future. With support of family in the States and an amnesty from the U.S. government, we immigrated to California. I grew up with strong peer supports because I had my 2 older brothers. When we visited the Philippine consulate and when I finally got my green card, I became an alien resident. Despite these stigmas, we were fortunate to have supportive communities who accepted us. When I got my PhD at the University of Pittsburgh, I became part of the 1% of people who reached this level of education. And this was possible because of generational support, because of my husband and the family support that I've had, and because of my son who inspires me. And all of this is not done alone. It's done and it has changed the trajectory of my life and my well-being. And this is why I'm able to present to you here today. Education is just one of the social determinants of health. And these are health factors that are non-medical that impact our health and well-being. Health is not just about individual behavior. It's about what opportunities individuals have to choose from. And these opportunities look different based on where you live, the color of your skin, and the circumstances that you were born in. The County Health Rankings model helps us see this vision, where policies and programs either support or restrict social determinants of health and health factors. And these are health factors that are modifiable that impact our health outcomes. That includes how long we live and our quality of life. And one of the most impactful health outcomes that are impacting us today are social and economic factors. These social determinants of health that I'm talking about is economic and poverty. Here is a community this is a clip of health by Dr. Kamara Jones. And here we see the orange community having supports in place, where the green community may be living in poverty, don't have access to primary prevention from helping them fall off this cliff of health. They have no safety nets to help protect them, and they don't have any medical care that helps them stay safe. Equity is the solution. When we think of equality, giving each person the same box is not meeting them where they are. It's clearly not. Where equity is meeting people where they are and understanding their differences so they have the fairness to watch the same game. And more so the liberty to remove this fence so that we don't need additional resources to be watching the same thing. Equity is done in 3 functions in public health. That includes assessment, really monitoring and investigating what are these health problems. And then the second is policy development. How do we educate and mobilize communities to actually solve these problems? And then more so, assurance. Are these solutions actually helping the communities that we care about? Here at Mills, in response to the first generation students and students of color, Dr. Apara and Dr. Young combined science and social justice into the public health and health equity program. And as the head of the program, I was able to develop internship-based course to help students actually be in partnership with and for communities. And I'll be highlighting these internships now. This is Meenakshi. She works at Monterey with Hamida, and together they help empower women to make decisions about their sexual and reproductive health. And Meenakshi reflects, I feel empowered knowing that I have helped improve the health of East Asian women in Oakland through a feminist and culturally relevant lens. This is a social media post with our student Nadia and her supervisor Sharice above. And through the DiTribe Foundation, they synthesize information about diabetes technology, policies and therapies, and distribute this information to over 10,000 professionals, industry leaders, and patients via social media. This is a partnership with our local children's school here. This is Supervisor Jenny with our student Akua in front. And together, Akua has said, this internship has helped me collaborate with the Alameda County public health officials to understand the impacts of COVID-19 policies and regulations, and the important role that local government and school administrations have to protect the health and well-being of families. This is Jennifer. Jennifer is working in partnership with Dr. Martinez at the Public Health Institute on her research study on alcohol causes breast cancer. Through this support, she's able to provide health campaigns that help women in California understand the impacts of alcohol consumption, and the increased risk of breast cancer. This is a collaboration we have with UCSF and Dr. Barach's research and health education team, who's currently implementing a youth empowerment sexual health program locally this January, virtually. And 2 of our middle students will be helping intern and assess that program at Castlemont High School in East Oakland. This is a student-led and student initiative from HAFA, who is the president of the Muslim Student Alliance. HAFA saw the importance of collaborating with Liberty North Korea, with Sarah and Professor Mickey featured in this picture, to bring awareness about the experiences of North Korean refugees, and it emphasizes the shared value of people over politics. This is Nadia, who also created an internship with Lincoln Family Services, specifically with Chris, featured here below, from the Mandela Family Resource Center in West Oakland. Together, we developed an internship where students can come support family navigators to help support families who have children between the ages of 0 to 5 years old. This is a screenshot of our recent added full spectrum doula training course. Through the initiative of Tess Waxman, she knew that there was a need to find something that was an affordable and accessible way to train to become a doula. And through the partnership with Cornerstone Doula Services, we were able to offer that. And Tess reflects that this was an important thing to have at Mills. This is a recent student-led event by Kayla, Lily, Esther, Mackenzie, and Jada. It's called Being STEM in Black, while Black. And it was important to reflect how health and inequities and exclusions in the classroom impact our Black students, and that recommendations were needed to understand how to do this better. Through my diverse experiences and the support of my communities from the Philippines to Mills College, I'm fortunate to work with students, community partners, and academics to work towards a more equitable public health together. This cannot be done alone. I encourage each of you to be involved in your communities and be the change that you want to see.
Thank you, Dr. Jaime. It's powerful, and I love seeing so many students that I even recognize a part of the movement. The audience, please come up with some questions for Dr. Jaime, and I will kick it off and end it on a great way, talking about how the community, should be engaged in this. And I'd love for you to elaborate more on what are some of the things that we can do as individuals, community members, to actualize and the vision that you've just painted.
I think it's being involved in what you're passionate about, right? So I didn't make this a health equity program. I did it together with the leaders before me, like Dr. Opara and Dr. Young, but really my students, right? Being close in proximity with our students. Our students are the ones who are living and breathing this every day in a different way. I'm living in a space where I'm fortunate and have been supported, and a lot of my students haven't. So being involved in the communities that they're in and allowing them to co-learn and co-create with you is really bringing a much deeper diversity than I could have ever imagined that connects me with community. And I think it's about getting closer to one another and having that proximity and not being scared to share our stories.
Mm-hmm. Great. So I'm still waiting for some questions to come in. So I'll ask one about, what was this process like for you? We haven't really talked much about the process, the creation process, and thinking about this really meaty question. So I'd love for you to maybe spend a few moments discussing how this felt for you to envision this future.
Sure. I think I really have the privilege to be part of it, right? To go back to those fractals, right? My small community, because all of us think in this grander federal scale, and it can seem so overwhelming to feel like all of this is on your shoulders. But what are we doing locally, right? How are we impacting what we are a part of, whether that's within our families, within our communities, within our job? Again, I'm super privileged to be in a space where I get to do this for work that I'm passionate about. I get to work with students every day and get close to understanding what are the discrepancies that they're facing. I currently have students who have family members who have passed away because of COVID-19. I have students who don't have access to internet because they're living in rural spaces. How do we understand that? We understand that because we listen and we hear their stories and we understand that they're going through so much. How can we support them? And whether that means extending an assignment that's due, or making an accommodation with a person who's dealing with grief. We need to understand that, and the only way to do that is if we actually know each other, if we actually build our communities with one another and get to know each other in this proximity that we're so scared to get to know one another.
Excellent. People-centered institutions, that came up in the chat. You know, and how do you, when thinking about public health, let's connect that with COVID. What are you seeing in terms of increased issues and inequities? Maybe perhaps you could speak to that.
Sure. As
how that's showing up for you, or even in the classroom.
Well, in the social determinants of health, right, we know that there's gaps that exist. I didn't have an opportunity to go into it, but we know health inequities exist, and not just with race ethnicities, but where people live. So if you go look at the county health rankings, you can actually look up your own county. All of your counties are listed. There's 58 counties in California, and this is done nationwide. So I actually encourage all of you to look that up, and you can look up your own county and see where your health ranking is. And you can really start seeing how this discrepancy is not just within racial disparities, but also geographical disparities. What's going on with our rural communities? What's going on with women? What's going on with children? And so it's really important to see that how COVID is actually revealing the inequities that have already existed, and it's exacerbated it, right? So we know that those who have more privilege and more advantages are still doing okay, but we're not talking about the people who are not. COVID is not just about stopping the spread of an infectious disease. It's about people's incomes and livelihoods. What's the mental health aspect of COVID? You know, we focus so much on getting this vaccine and investing all this money, but yet we're not focusing on prevention. Why aren't we stopping this infection to begin with? Why aren't we encouraging supports for food insecurity and economic support? But instead, we're putting all of our resources, like I said, to that medical aspect, when there's so much more we can do on the ground to help so many more.